All right, let's get right into it. Today, we're talking about a medication called terbinafine, and trust me, it's not just any pill. We're going to uncover the story of how it wages this incredible, microscopic war against some of the most stubborn infections out there.
I mean, have you ever really thought about it? How does one little pill manage to track down and destroy a super stubborn infection? You know, the kind that creams and lotions just can't seem to handle. Well, that's exactly what we're going to do. We're pulling back the curtain to see how this tiny warrior wins the fight.
Okay, so first things first, let's set the stage and meet the bad guy in the story. We're talking about fungal infections. And let me tell you, these things are notoriously tough customers. They're just so hard to get rid of, especially once they've really dug in.
Yeah, we're talking about things like nail fungus, athlete's foot, ringworm, and they're way more than just a little annoyance. The culprits are a type of fungi called dermatophytes. And you want to know what makes them so darn persistent? It's kind of gross, but they literally live on us. They eat the keratin in our skin, our hair, our nails. That's their food source. So they set up camp right where it's the absolute hardest to get to them.
But, every good story needs a hero to fight the villain. And in our microscopic drama, the hero's name is terbinafine. This is a seriously powerful medication that was literally designed to hunt down and, well, eliminate these fungal enemies.
And terbinafine isn't just, another drug on the shelf. It's often called the gold standard in antifungal therapy. And there's a really good reason for that. When it came along, it was a massive leap forward. It completely changed the game, the whole strategy for how we fight these things.
So here's the absolute key difference. You see, a lot of the older antifungal meds are what we call fungistatic. Think of it like they just hit the pause button on the fungus. They stop it from growing, but they don't get rid of it. Terbinafine? Totally different. It's fungicidal. It doesn't pause the enemy, it goes in and actively kills it. And that, right there, is the game changer. It means shorter treatments and way less chance of that nasty infection making a comeback.
Okay, so the big question is, how? How does it actually kill the fungus? This is where things get really cool. Terbinafine doesn't just have one trick up its sleeve. It has a secret weapon, a killer two-hit combo.
So, any good attack plan needs a target, a weak spot. For terbinafine, that target is a substance called ergosterol. The easiest way to think about it is like this. Ergosterol is the armor for the fungal cell. It's what gives the cell its structure, its integrity. Take away that armor, and the fungus is totally exposed and vulnerable.
And this is how that two-hit combo works. Hit number one is sabotage. Terbinafine gets in there and just wrecks the fungus's armor factory. It blocks a specific enzyme, which basically shuts down the production line for ergosterol. So boom, the cell's defenses start to crumble. But wait, it gets even better. That's just hit one. Hit number two is poison. See, by blocking that production line, the raw material for the armor, a stuff called squalene, starts to build up. And for the fungal cell, a huge buildup of squalene is totally toxic. It's pure poison.
So you see what's happening? The cell is getting hammered from two sides at once. On the outside, its armor's gone. On the inside, it's filling up with poison. This 1-2 punch is just devastating. The cell can't handle it. It literally breaks apart and dies. That's what being fungicidal is all about.
Okay, so now we know the how, the secret weapon, so let's talk about the what. What specific infections is this fungus-killing super agent actually approved to take on?
Well, its main mission, the big one, is nail fungus. The official name is onychomycosis, and it is notoriously hard to treat. But terbinafine is also a go-to for really bad cases of athlete's foot or ringworm that spread all over, basically any of those stubborn skin infections that just laugh at the creams you put on them.
All right, but here's the thing. When you're dealing with something this powerful, you've got to be careful. There are, let's call them, rules of engagement. Terbinafine is incredibly effective for sure, but it's also a serious medication. This is not something you mess around with. It absolutely requires a doctor's supervision.
So, what are the risks? What do you really need to know before even considering it? Let's get into the side effects and, just as importantly, who should definitely stay away from it. This gives you a pretty good picture. The vast majority of the time, if people have side effects, they're on the milder side. Maybe some stomach upset or a rash. One that's kind of weird but happens is a change in your sense of taste. But, and this is the important part, there is a small but very serious risk to the liver.
And because of that potential liver issue, no matter how rare, the medical guidelines are crystal clear. Before you start, your doctor will likely want to do a blood test to check your liver. It's all about making sure you're good to go and that it's safe for you to take.
Which leads us to the big do not take list. And the rules here are strict, no wiggle room. If you have chronic or active liver disease, or if you have major kidney problems, oral terbinafine is just not for you. It's what doctors call a contraindication. Plain and simple, it's off the table. Another really important thing to know is that terbinafine can mess with other common medications. See, it affects a key enzyme in your liver, and that can change how your body handles all sorts of things. We're talking certain antidepressants, some beta blockers for blood pressure, and, get this, even caffeine. So yeah, that's why it is absolutely critical to tell your doctor about every single thing you take, no exceptions.
Okay, so we've covered the what, the how, and the what to watch out for. Now let's talk about the end game, the path to actually winning the fight. Because taking the pill is only half the battle. The other half, patience.
So what does the typical mission look like? Well, for fingernails, you're usually looking at about 6 weeks of treatment. But toenails, they grow way more slowly. So for those, it's a longer haul, typically 12 weeks or 3 full months of taking the pill every day.
And here's one last cool science tidbit for you. Terbinafine is what's called lipophilic, which is just a fancy way of saying it loves fat. Because of that, it actually gets absorbed and stored in your skin and nails. This creates something called the depot effect. It's awesome. It means that even after you finish the treatment, the drug is still hanging out in your nails for weeks, continuing to fight and making sure no fungus tries to make a comeback.
Now this next part is super important for setting expectations. The pills might kill all the fungus in 3 months, but your body still has to do its job. It can take a full 6 to 9 months for that old damaged toenail to completely grow out and for you to see that brand new healthy nail. So you've got to be patient. The victory is coming, it just takes time to see it.
And that brings us to the final, most critical point of all. Even if things start looking better halfway through, you absolutely have to finish the entire prescription. Stopping early is the single biggest reason these infections come back. So what's the real secret to winning this microscopic war? It's a combination. A really smart, powerful weapon like terbinafine and a patient who is committed to seeing the mission through right to the very end.